Today we are going to learn about the primary immunodeficiency disorders. So under this, firstly we are going to ask some questions. So first question is name some humoral immunity disorders. The second question is what are the combined humoral and the cellular immunity. So what are the disorders associated with this? Third question we want to ask is what are the complement proteins disorders? So in this video we'll find the answers to all these questions and learn a lot more in this subject. So to start off with, first we'll look at the effect component in the immune system. So first we're going to talk about the humoral immunity. So what is the humoral immunity? So under the humoral immunity, they are nothing but the problems with the B cells. We're looking at the problems with the B cells. Problem with the B cells and the antibody production. The production. So what are the disorders associated with this? So the disorders, it includes a common variable immunodeficiency. Then it also includes the selective immunoglobulin deficiency. So such as the IgA. Next, there is also the transient. There is a transient hypogammaglobulinemia of infancy. Next, there is also the X-linked agammaglobulinemia. There is X-linked agammaglobulinemia. Then we move on to the cellular immunity. So what does the cellular immunity contain? So looking at the cellular immunity. So under cellular immunity, we have the problems which are associated with the T cells. So T cell problems associated with the T cell problems. And what are the conditions? The conditions here, it includes a chronic mucocutaneous candidiasis. So there's chronic mucocutaneous candidiasis. This is one. Then it also includes the D-George syndrome. Next, also the X-linked lymphoproliferative syndrome. Then we look at the combined humoral, and the combined humoral and cellular immunity. So it is nothing but the problems associated with the P and the T cells. So here, what are the conditions? So the examples here are, there is the ataxia, telangiectasia. Then there is also the hyperimmunoglobulinemia M syndrome. So further we are going to look at other examples. It also includes the severe combined immunodeficiency. It includes the severe combined immunodeficiency as well as the Wiskott-Aldrich syndrome. Next, we look at the phagocytes. Under the phagocytes, we look at the problems with the movement and killing. So there's issues with the movement as well as the killing. And now, what are the examples? What are the issues with the phagocytes? So it can lead to the chronic granulomatous. It can include a chronic granulomatous disease. Next, it can also include the Chediak-Higashi syndrome. So this is actually very rare, but still it is included. Then there is also the tough sins deficiency. Next, there is cyclic, the cyclic neutropenia, as well as the leukocyte adhesion defects. Then we look at the other category. So this is nothing but the complement proteins. The complement proteins. So what are the complement proteins? They are nothing but the deficiency. The deficiency of the complement proteins is what we are looking at. And the examples here, it includes the complement, the complement component 1, that is nothing but in short known as the C1 inhibitor deficiency. And this is the hereditary angioedema. Next, we also have the terminal component. We have the terminal component deficiency, that is the C5 to the C9. That is, there is the recurrent Neisseria infections. The recurrent Neisseria infections. So now we'll move on to answering our questions. So what is the first question we asked? The first question we asked was about the humoral immunity. Humoral immunity. So what are the examples? So humoral immunity are nothing but the problems with the B cells. Problem with the B cells plus the antibody production. So the disorders here, as we look, it includes the common variable immunodeficiency. Next, it also includes the selective immunoglobulin deficiency. The selective immunoglobulin deficiency. Then, so this is such as the IgA deficiency. And next, we also have the transient hypoglobinemia and hypoglobinemia of the infancy. Next, we also look at the X-linked gamma globinemia. So the next question we asked was, what is a combined? That is a humoral and the cellular immunity. So what do you mean by this? It includes the problems of the B and the T cells. So what are the disorders associated with this? So now as we look, the disorders it is associated are, it includes the ataxia. It includes the ataxia telangiectasia. Then it also includes the hyperimmunoglobulinemia M syndrome. Then there is also the severe combined immunodeficiency, as well as there is the Wiskott-Aldrich syndrome. So just to recap, the combined humoral and cellular immunity, which includes the B and T cells, it includes the ataxia telangiectasia, hyperimmunoglobulina, M syndrome, the severe combined immunodeficiency, as well as the Wiskott-Aldrich syndrome. Next, what we see is we look at the complement proteins. So, what are the complement proteins? So, under complement proteins, it is nothing but we are dealing with the deficiency of the complement proteins. So, the examples are there is a complement, there's complement 1, complement component 1. So, it is known as the C1 inhibitor deficiency, C1 inhibitor deficiency, and that is the hereditary angioedema. Then we also look at the terminal complement deficiency. The terminal complement deficiency. So what does the terminal component deficiency deal with? So the terminal component deficiency is nothing but it is C5 to C9, and this includes nothing but the recurrent Neisseria infections. Now we'll be looking at some bonus questions. You can answer these questions in the comments. So the first question we would like to ask is, what are the disorders of the cellular immunity? The second question we would want to ask is, what are the phagocytes disorders? Disorder associated with the phagocytes. So you can answer these questions in the comments.